I'm Jean Flegel. I'm the spine orthopedic nurse practitioner here at Skyridge Medical Center. We're so happy that you've joined us here today, whether it's in class or on video. Let's get started. I'm going to tell you a little bit about the spine to start out with. This is your pelvis, this is your head, this is the front of your spine, this is the back. When you rub your hand up and down your back, that's what you feel, all those bumpy parts. Okay? You're probably familiar with these bony parts. This is called the vertebrae. There's the front of the vertebrae, and then there's the back of the vertebrae. And in between the front and the back, that's where your spinal cord runs. Okay? It runs down to about level L2. And I'll tell you how we count this in just a minute. After that, it's just a series of nerve roots coming out on both sides, as you can see, and as you probably saw in the pictures in your book. Okay? So you have to note that even when the spinal cord finishes at L2, there's just this bunch of nerve roots coming out. It's called the cauda equina, or horse's tail. In between these bony sections are what we call discs. They're sort of like jelly donuts. Those are kind of your shock absorbers, if you will. Okay. As we get older, as we have wear and tear on our discs and so forth, we get what's called degenerative disc disease, another nice way of saying arthritis. Or sometimes we have a fracture there. When we do have arthritis, sometimes our bone tries to repair itself. And what happens if we have little bony projections that come out and they'll hit this nerve root? But for most of us, what we have is called degenerative disc disease. And these discs are sort of like jelly donuts. In this particular model, you can see here where the jelly is sort of squirted out, or it's like a herniated disc. And you can see it's impinging on this nerve root. But as I mentioned, and some of you may have identified on your MRI, your doctor may have said, oh, your disc is like a pancake where it's very, very dark. It's lost its water content. So what happens when we have degenerative disc disease